don't get treatment. Now, why is that important, and what's that got to do with DSM-5 and the ASAM criteria? Well, one of the things that increasingly we have to think of if we're working in addiction treatment and mental health is that we're going to need to reach out and start to integrate addiction services much more into general healthcare services and mental health care services, because the customers are not really going to be coming to us. We've got to reach out and intervene with them. Now, we've always known that, but why is that more of interest in the healthcare reform? Well, firstly, there's going to be millions more people who have access to treatment. I guess about over 4 million have signed up so far, and that's not all the people who could get coverage, but firstly, there's going to be more customers and more people interested, at least potentially interested in addiction treatment. But where most of the people who need addiction treatment are in settings where we often don't have a good presence, and where people are not actually all that interested in inviting us in, except now with healthcare reform, because increasingly people will be paid for keeping people well and for population management, as opposed to getting paid and doing well if people are sick. So now if you get dinged and the hospital has to have penalties, financial penalties, if a person gets readmitted within 30 days, now hospitals are going to be interested in identifying those people who keep coming back into the hospital, who before they would get paid for filling a bed, and now they're going to be financially disadvantaged by having that person come back. So I was talking to a couple of nurses who were really looking at how do we intervene with the people who keep coming back, and they said about 60% of those people who get readmitted have addiction problems. And so now people are interested in addiction, not necessarily because of the milk of human kindness, but because this is going to cost them money if they don't intervene and identify people who have addiction problems. So that means that we have to be clear on what a substance use disorder is, what the DSM-5 diagnoses are. We're going to have to teach general health care people about that, the importance of screening and brief intervention and referral to treatment. And when we get to the ASAM criteria, the importance of levels of care like early intervention. So putting that in the context of DSM-5 then, to really understand what are the diagnostic categories, how has the